Building coffins is a quiet ritual here. AIDS kills like clockwork in this area. It's a production line of death.
From really the mid-1990s, HIV in South Africa exploded. At one point, about 1,000 HIV-related deaths every single day. So it was a catastrophe, it really was.
AZT or retroviral was the first drug to work against AIDS.
Really in the middle of the 1990s, a class of medicines became available which could stop people dying of AIDS. We saw these medicines, we saw what they were doing in other countries in the world, but they were too expensive. They cost about 5,000 rand a month, so they held out this hope, but this hope was something that we couldn't reach, and the deaths continued. So in 1997, the government amended a law, and the aim of this amendment was to give government more power to make medicines more affordable.
Many of these children have been orphaned by AIDS, and in this Soweto hospice, others have the HIV virus.
The legislation the government is trying to bring in is intended to help many children like these. The government says it wants to be able to import cheaper generic versions of well-known drugs. But the pharmaceutical companies say that threatens their patents and endangers new research.
But almost as soon as government introduced this new law, 39 very powerful multinational pharmaceutical companies went to court to stop this law from being passed.
Instead of simply copying our drugs, why don't they innovate the next range of HIV medicines? And why don't they do it quicker than us, faster than us, better than us, and cheaper than us? Clearly, it's not that easy.
And for 3 years, the law was stuck because of this legal action. So when we formed the Treatment Action Campaign, we decided to go and get our own lawyers to join the South African government in its effort to bring this law into force. And we were successful.
The world's largest pharmaceutical companies have bowed to heavy pressure and dropped their court action against South Africa importing cheap copies of their AIDS drugs.
In court, there was jubilation.
We thought we'd won. Unfortunately, our government had a different idea because our President Mbeki, had begun questioning whether HIV caused AIDS.
It's the misunderstanding about the science of this question.
And so they didn't make these drugs available, even though they could now afford to make the drugs available through our public health service. So the victory was almost nullified and our struggle had to continue. 6 months later, we were back on the streets, we were protesting, we had to launch a new court case, this time against our government, over the question of access to drugs that prevent mother-to-child HIV transmission. The intervention was so simple and so cheap.
A single tablet of nevirapine, which costs about 10 rands, can save children from HIV.
It was as simple as this to prevent a new HIV infection and to save a life. And in July of 2002, the Constitutional Court unanimously ordered the government to supply these medicines to pregnant women who had HIV.
The steps that have to be taken to comply with the order that we make should be taken without delay.
It was another very, very emotional moment. And after we'd won, we were in a much stronger position to move straight on and say that these medicines should be made available to any person who had HIV or AIDS in our country to save their lives as well. 20 years later, we look back on those days and I can say to you, with my hand on my heart, that our struggle probably saved 5 million lives, because today 5.5 million people have access to anti-retroviral medicine, and you can put that down to the struggle that we waged in those years to make this a right for all people.